The World Health Organization is set to hold a meeting today in Geneva to review new rules for dealing with pandemics. The Pandemic Accord is the Global Health Agency's effort to shore up defences against new pathogens after COVID-19 claimed more than 6.6 million lives. The WHO already has a treaty setting out rules and obligations for all countries in case of public health events. But the COVID pandemic has cast serious shadows on the agency's ability to investigate and contain major outbreaks. Proposals for the new pact include boosting transparency in data sharing and rules on equitable vaccine distribution. We spoke earlier to Associate Professor Sanjaya Senanayake, an infectious diseases specialist at the ANU Medical School, and he says that while the world has endured a fresh pandemic, it may be tricky to enforce rules equally across the globe.
The main factors are making sure that as a planet or as member nations, we're globally prepared to face pandemics and prevent them, of course, before they occur. We want to make sure that there's sustained funding. There's no point having all these plans in place if countries, particularly poorer countries, can't afford to incorporate them into their budget. So that has to be something that will involve global cooperation. And we have to make sure at a World Health Organization level that we promote trust between member nations so they don't feel scared about coming out about an outbreak and face the problems that South Africa did when they identified some variants because of their very good public health system. We have to make sure we ensure that trust and ensure accountability and get a good sense of transparency.